Okay, we continue to gallop through the alphabet for the conditions part of the MLA, micro lectures. Meniere's disease. So generally comes under the ear, nose and throat provenance, but we're doing it here. And it's usually a combination of peripheral eighth nerve problems. So vertigo, tinnitus, ringing in the ears can also be a machinery-like repetitive sound, and loss of hearing. And it's an inner ear problem. Episodes last minutes to hours. People can feel very nauseated with the imbalance. It can start in one ear, then involve the other ear in about a third of cases. And people tend to be in middle age going into older age, and for some reason more common in women than men. For that reason we think probably an autoimmune source, but we don't know for sure. In terms of investigations, you're looking for anything that would cause disruption to that part of the brain or the eighth cranial nerve. So you do imaging, especially if there are other cranial nerves involved. You wouldn't expect that with Meniere's. So if they have facial weakness, not Meniere's. You do a Dix-Hallpike, which is a maneuver of sort of moving the head and sort of tilting the head, looking for whether or not there's any disruption of the inner ear. You're looking for otoliths or crystals in the inner ear, and you can treat that. So that's benign paroxysmal positional vertigo, BPPV. You can treat that with Epley's maneuver, so that's a sort of slow, graduated version of the Dix-Hallpike, and it can move those causative crystals, those naughty crystals, out of the semicircular canals, and people eventually swallow them, and the cause for their dizziness is gone. Very satisfying to do. People are very poorly, very dizzy, and then you fix them, and they think you're wonderful, which is nice. If that's not the case, if imaging is normal, they then would have audiology, hearing assessments to see if their hearing is reduced, and vestibular testing, which isn't always abnormal. And lifestyle changes is generally what's recommended, but generally there's no obvious sort of lifestyle problem that could be addressed by this. There are vestibular sedatives like beta-histine, which can temporarily calm down symptoms, and if people have bouts of dizziness, they might take these temporarily just to get over those bouts. But in the background, their balance and hearing may continue to decline. Hearing aids can help with the hearing element. Balance training can help with rehab after each cumulative bad attack. Sometimes people have treatment of the inner ear, but it's not always successful, can lead to more profound hearing loss. And there may be driving guidance necessary, particularly if people are dizzy sitting down. Obviously, you're not safe to drive if you're dizzy sitting down. Thank you.